Good day, students! Heads up! We'll be learning new stuff for today, the fetal heart monitoring using a stethoscope. But first of all, I'm going to introduce myself to each and every one of you. My name is Sabra of BSN 2-1, and I will be your guide through Nursing 107, the care of mother, child, and adolescent. So what time is it? It's time for learning! For today, we're going to learn the fetal heart monitoring using a stethoscope and on how we're going to communicate with our client. We're getting the fetal heart tone with the purpose to assess the rate, rhythm, and presence of absence of fetal heartbeat. The materials we'll be needing for this is bed, pillow, top linen, and stethoscope. As a nurse, we must be taking consideration for the following before we proceed to the actual procedure. First, explain the procedure to the client. Second is provide privacy. And third, to always communicate with a smile. Prepare the assessment before we do the procedure. First, client's level of consciousness and ability to follow instruction. Second is the client's age of gestation. It should be 5 months or 20 weeks. Good day, ma'am. My name is Sabra. Your nurse will be accommodating your care for today's clinical visit. May I know your name and age? Good day too. My name is Mrs. Smith and I am 32 years old. Alright, Mrs. Smith. Today we're going to check your baby status. Begin communicating with the client first by identifying the correct patient, introducing yourself to the patient, and explaining the procedure. Before anything else, remember to do the hand hygiene. Assist the client to lie on the bed on a dorsal recumbent position, to relax abdominal muscle and carefully expose the part to be examined. And remember to drape properly for their privacy. Perform the second step of Leopold's maneuver, the umbilical grip, to locate the fetal back, and after locating the fetal back, place the diaphragm of the stethoscope to assess the fetal heart sound. Count the number of heartbeat in 1 whole minute. Remember the normal values of the fetal heart rate and rhythm to assess any indication of distress or abnormalities of the rate in the fetal heart. After the fetal monitoring, carefully assist the client to get up from the bed and do the hand hygiene. Do not forget to document your finding on the client's record. Once you are already done, let your client know that you are already done with the procedure and that the doctor will let her know everything else. Bid goodbye to the client as you finish the appointment. And that's it, a short and sweet procedure of fetal heart monitoring using a stethoscope. As we venture the learning of fetal heart monitoring, I hope to give you a clear knowledge that can help you achieve that RN. Again, my name is Sabra of BSN 2-1. Goodbye and see you on the next adventure.